cognitive behavioral therapy, Insomnia. If you are unfamiliar with cognitive behavioral therapy in general, it is a technique that therapists and psychologists use to teach individuals how to change their thinking, which also affects your behavior. Identification and replacement of negative thinking patterns, and teaching individuals how to think in a healthier manner so that it changes their behaviors. The insomnia component relates directly to how our thoughts and behaviors affect our sleep, or vice versa. So we'll talk a minute about that. The cognitive component of the cognitive behavioral therapy is all about changing the way you think. I work a lot with kids and teenagers and adults who have extremely negative thoughts about sleep. So once we rule out a medical diagnosis, and thankfully Dr. McWool helps me doing that, if we find that there is not a medical diagnosis to affect their sleep, a lot of times we learn that it's because of their negative thinking patterns about sleep. A lot of the kids and adolescents I see have terrible thoughts about sleep. We talk about changing negative thinking patterns like black and white thinking or all or nothing thinking. I never get good sleep. I hear that a lot. Or I always have trouble sleeping. So once we have a thought like that, our brain is going to look for evidence to make that thought true. We're only going to focus on, it's getting to be close to bedtime, I'm not going to be able to sleep, or I'm going to have a hard time falling asleep. Likely, the individual will have trouble falling asleep if they believe they're going to have trouble falling asleep. We talk a lot about recognizing that and helping kids and teenagers and adults recognize these thoughts. They're automatic. We think them automatically, and a lot of times we don't recognize that we're doing it. So helping kids weed out those negative thoughts and recognize them and change them so they can have healthier thoughts about sleeping. Catastrophizing is another negative thought that we teach individuals about. What if I don't get enough sleep? What if I don't get 8 hours of sleep? I'm supposed to have 8 hours of sleep, right? That's what we hear. What if I oversleep? What if once I fall asleep, I don't wake up and I miss my first class? So a lot of these what ifs tend to lead to increased arousal, increased stress response, and then therefore we have difficulty falling asleep because our body is not relaxed. Another one I hear a lot from really my teenaged kids that I work with, the shoulds, the expectations we put on ourselves. I should get 8 hours of sleep. I should be able to wake up feeling perfectly rested. These expectations, again, increase our stress response. They do not allow our bodies to relax to fall asleep. So teaching individuals about your thoughts and about how they can affect sleep is something we do in our office a lot with kids. And we use a lot of fun techniques to do that. And we're going to talk about that in just a little bit. And again, the behavioral component helps individuals develop good behaviors so that they can sleep well. Sleep stimulus control, sleep hygiene, and using relaxation strategies are tools that we teach in our office to individuals to assist them with their sleep issues or insomnia. Sleep stimulus control is a large part of cognitive behavioral therapy for insomnia. Techniques are designed to strengthen your association between your bed or your bedroom and sleep. We work a lot with parents when we're treating kids because parents are a huge factor, caregivers, guardians, helping them recognize that your bed is only for sleep. Going to bed at the same time every day. We stress routine if we can. Going to bed at the same time every day and waking at the same time every day. I usually emphasize to try and do that 5 to 6 days of the week. There's always other factors that keep people from going to bed at the same time or waking up at the same time every day. If you're in bed and you can't sleep, I hear about kids all the time saying, I just lay there all night and I close my eyes and I just can't turn off my brain. My brain isn't tired. We try and teach kids, don't lay in bed any longer than 30 or 45 minutes if you're wide awake. We need to associate our bed with sleep, not with being awake. So I'll work with parents on if they need to get out of bed, if they're having trouble sleeping, have them do so still in their bedroom, in a dark room, use a book, maybe not an iPad or a phone, something to keep their body and brain calm, but allow them to not just lie in bed awake all night long, because that's definitely not going to help either. Using your bed or bedroom for sleep only. A lot of my teenagers love to do their homework on their beds, or they love to lay on their phone, lay on their bed and be on their phone in bed, or watch TV in bed. For individuals who have issues with sleeping or insomnia, these are not good practices. Maybe some people can do that and sleep just fine, but it's not recommended. It's not recommended for good sleep, and it's not good for your health either. So we only recommend using your bed or bedroom for sleep only. Wake up at the same time every morning, we touched on that, and no napping during the day. Parents will bring children to me because their kids just can't sleep, and I'm learning that they're taking a nap at 6 p.m. before they go to soccer at 7:30. Easy fix, I don't want to say that, but there's a very big clue there. No napping during the day, especially late in the day. That can greatly affect sleep. And some individuals do not know that. So it's our job to help educate parents and children about these things. Sleep hygiene. These are practices. These are things that children and adults and adolescents can do to ensure quality sleep and daytime alertness the next day. Again, touching on going to bed at the same time, having a bedtime routine. I work a lot with parents on winding down before the end of the day, helping their kids have a wind down time before bed, not just going from soccer straight to the bed. Turning down the lights, making sure your environment is calm and restful. Maybe a bedtime routine would be structural things like brushing your teeth, washing your face. That way your body and your brain expect that it's time for sleep. We tend to relax more too. When we have structure and routine, our body relaxes more. We know what's expected. So our sympathetic nervous system winds down, our parasympathetic nervous system increases, and our physiology is more ready for sleep. Removing electronic devices like TVs, smartphones, gaming devices from the bedroom, really important. I love working with kids. I think kids love working with me until I tell their parents to take away their tablet. And then they're like, I thought you were my friend here, you know? Or limiting use before bed. You know, we compromise a lot. With the CPAP and the tablet, it's a great idea. I think compromise is important. Every child is different. Limiting smartphone, the screen, the light, we want to limit that. Teaching parents and kids to avoid large meals before bed. You don't want to go to bed really full. It's uncomfortable. You can't rest as well. On the other side, you don't want to go to bed really hungry either. So a good meal time, again, that falls into being very structured, having a routine. Not a lot of spicy food before bed. That's also going to disrupt your GI system, make you feel uncomfortable, which again makes it more difficult to relax. Getting exercise, but also not getting exercise too late in the day. After school, a lot of routine for kids is to do sports after school. Some sports go really, really late. I've learned that. I don't have a teenager, but I've learned that I hear kids at soccer or dance or football until 9, 10 o'clock. I don't want to pull them out of their sports. We never want to do anything like that if they enjoy it, if it's a positive thing for them. But again, we'll have to find some compromise there if they're struggling with sleep and if that's causing issues at school or at home. And again, that emphasis on winding down. Bedtime routine, starting to slow things down in the evening, really important for good sleep hygiene. Relaxation training. These are tools we teach kids to calm their bodies down, to calm their brains down, to relax. Things that involve paced breathing exercises, progressive muscle relaxation, Passive muscle relaxation, visualization and autogenic exercises, and mindfulness. Some kids just, again, we've talked a lot about breathing and respiration here. Some kids hyperventilate. Some kids breath hold. We want to work with kids on teaching paced, slow breathing so that their parasympathetic nervous system can turn on and they can get to rest easier. We see a lot of kids with anxiety and depression, mood disorders that are very tense, that have a lot of muscle bracing, a lot of pain as well. So teaching progressive muscle relaxation is key. We do this multiple times a day with several people. Tensing and relaxing muscle groups gives kids the idea that they can control their bodies. They can have self-efficacy. They can be in control of how they feel. And a sense of independence, which increases confidence. And again, you're able to rest easier and to control your sleep, your behavior. The goal is to help the individual to increase their parasympathetic response so they can sleep and rest easier. So biofeedback is a specialty we provide at our office. I have 2 other board-certified biofeedback therapists that specialize in working with children and adults. It essentially is like the relaxation training that we talked about before, although biofeedback allows an individual to see this information on a computer screen and learn from it. So when we're teaching breathing exercises or if we're teaching muscle relaxation, not only is the individual able to feel what they're doing, but they can see their physiological measurements on a computer screen so they can make that connection about how they can control their physiology. So it's visual physiology. We measure everything from respiration, breathing. We measure surface muscle tension, EMG, EKG. Sometimes we'll measure EEG, not as much as we do the others. Electrodermal response measures the skin conductance or the sweat on your hands. Again, all of this relates to the stress response, which we work with kids on trying to decrease the stress response so they can relax to elicit sleep more. A lot of kids are very unaware of their physiology. They may not realize that they're tensing their muscles or that their hands are really clammy or even that they're hyperventilating or breath holding. So it's our job to help recognize these things in children if there are issues and teach them how they can control it and change it. And the cool thing is there's a lot of really great software that allows the kids to have a lot of fun learning how to do this. That's the best part about this. Feeding the information back to them on the computer screen. And it involves a computer or an iPad. They're in 100% of the time. Here's a few different of the biofeedback measures that we use at our office. Measuring, like I said, EKG or electrocardiograph, electrodermograph, which is the skin conductance, which we measure. Sweat gland activity tends to increase in our periphery when we have a more aroused sympathetic nervous system or maybe like an anxiety disorder or stress. We use sensors that basically clip onto the fingers to measure that. EEG, again, if we do that, it would be using leads on the scalp to measure EEG activity. EMG, we do a lot of this for stress disorders like muscle bracing, intractable upper quarter pain. We've got a lot of pain disorders that we see, headaches, migraines, neck and shoulder, trapezoid tension. We'll use these sensors to measure that and display on a computer screen how an individual can change that. Feedback, thermometer, thermal biofeedback. There's a lot of research on thermal biofeedback and insomnia and sleep and the relaxation response. So we'll do a lot of temperature training for insomnia, relating directly to the heart rate, blood flow, and the temperature of your periphery versus your core in sleep. Warmer hands, more blood flow, lower heart rate. Teaching individuals to increase their peripheral finger temperature can teach them that they're in a more relaxed state. And respiration, using respiration belts. We'll usually put one around the chest, around the lower abdomen, to teach individuals how they're breathing, if they're reverse breathing or if they're breathing abdominally versus the other way. So a lot of education goes on here. A lot easier to do this with adults, but we have great play therapists that work a lot with kids, so we make it fun to teach kids about your body as well, about their body. And sometimes kids don't want to wear all these wires. They're scary. What are you doing to me? Are there needles? I'm out of here. But most of the time, they're open to it when they know that they can play a game with it. And we never put all of these on at one time. It might just be a thermistor or an EMG sensor. So we definitely don't overwhelm the children with all of these measures at the same time. Biofeedback is fun. We work with kids. We need to be creative. We need to make these things fun and interesting, or they're not going to want to come back, or they're not going to get better. We use really cool software from Brainmaster, Thought Technology, Stens. They make a lot of biofeedback equipment that will display their physiology on a screen. So on the left here, we have a screenshot of a measurement of teaching a child or an individual to decrease their arousal level, increase their finger temperature. When they're able to do that, that flower will open. A little, I guess it's a bumblebee or a fly or something, a ladybug, I think, flies out. Positive feedback, teaching them that whenever they meet physiological goals, they receive a reward. If they start to stress out, or if their physiology tends to do not what we want it to do, that flower will start to close back up and they won't receive the reward. Same thing with on the right side, the car. The car will drive the course if their body is physiologically relaxing. If their body is physiologically tense or anxious, the car won't move. And fog will cover the screen and the music will go away. So we've got visual and auditory reinforcers in place for the feedback. And kids really enjoy these games. There's a lot more, but the race car game usually wins. It's the most fun game. Working with younger children, and we're 3, 4, 5, our youngsters, our young kiddos, the most important thing that we do as therapists in the beginning is building rapport with kids. Kids have to trust us. They usually see us weekly, so this is something that we need to have a good relationship with them. There's a biofeedback company that makes a board game and focuses on your emotions and your body, which is usually where I start with kids. How do you feel? What does your body feel like when you feel angry? What does your body feel like when you're stressed? This all relates to sleep. Kiddos who have difficulty sleeping are likely going to have difficulty with recognizing their emotions or how their body feels. We use that game, Wild Ride to the Heart. It's a great game made by a biofeedback company called Heart Math that does that. We use a body map to help kids recognize in their body where they feel tension or stress or pain that may or may not relate to their sleep, but maybe to their anxiety or depression. We use colors, markers, again, wanting to make this fun, wanting to help the kids build a good rapport with the therapist so that they can learn more about what's going on that might be affecting their sleep. I've had the most interesting results with the body map and the coloring, more than I ever thought I would when I was doing this with adults, when we would just use like an ink pen and mark things. I've had kids draw all over it, talking about different pain, stomach pain. My tummy hurts when I think about going to school, so I can't sleep. My hands are really cold. They feel like ice. Tingling. I had a young boy only take the red crayon and circle his head And I was thinking, oh, he's probably about to tell me that he has headaches and that keeps him from sleeping, or he's afraid he'll get a headache, so that keeps him from sleeping. And he just said, I have a bunch of really scary thoughts at night. And so, you know, that was, to me, that said a lot. Only just the scary thoughts. So we definitely worked on a lot of psychological techniques. But we want to have fun with kids. We want kids to feel like it's a rewarding experience, to learn about their bodies, to learn about their thoughts, and how it may affect their sleep. And teach them some tools to take home and use so that they can control their thoughts and behaviors about sleep, and so their behaviors can also change to help with sleep. We've all touched on this today, but working with other professionals is essential. We've done a lot of work over the years with Dr. McBool. We call it the team approach at our office, working with teachers. When you're working with children, we work closely with teachers. With consent from parents, we will contact teachers, or teachers can contact us, and we'll work with them to allow the teacher to understand maybe what we're working on at home that may affect their child's academic life or behaviors that they see at school. There are some really great educators out there that will be in contact with us weekly so that they know what we're working on and they can implement some strategies in the classroom as well. And working with other therapists as well. PT, OT, speech language pathology, we all come together to help out the kiddos. At home, working with parents, working with siblings. Sometimes we do sibling therapy. We talk a lot about pets in our office because they're a part of a lot of families, and usually being around pets is relaxing to kids. We talk about touch and sensory. And other medical professionals, working closely with everyone to ensure that we get these kiddos the help they need to get good sleep. And that is it for me. If you have any questions or comments, I'm happy to stick around after as well to make sure we stay on time. All right, thank you.